Hello everyone, this is Cyrus from Pure Lab Vitamins. Today I'd like to talk to you again about vitamin D. With the second wave of the pandemic looming, now is the time to learn more about vitamin D and optimize your vitamin D blood levels. There is growing evidence that keeping your vitamin D blood levels above a specific level in the middle of the vitamin D reference range can have significant impact on your body's ability to deal with a potential COVID-19 infection and alter the course of the disease. We have been promoting vitamin D for many years now, but instead of just following a standard or the standard dosage recommendation by Health Canada of just 1,000 IU per day for everyone, we argue that mainstream medicine should aim to optimize the vitamin D levels individually. So what does that mean? To date, more and more studies surface connecting good vitamin D blood levels with milder courses of COVID-19 infections in all age groups. One study by Grassroots Health, a non-for-profit organization, categorized COVID patients based on the severity of symptoms that they encountered and then measured vitamin D blood levels in each group of patients. And they were able to show that 98% of those patients with only milder courses of the disease had vitamin D levels over 75 nanomoles per liter. Mild symptoms in this study was defined as having mild symptoms without any diagnosis of pneumonia. One other study by the Wiley Group, published in the Journal of Alimentary Pharmacology and Therapeutics, looked at the number of severe cases per capita in countries in the northern and southern hemisphere of the globe compared to countries closer to the equator. Testing frequency and testing volume in each country did not matter in this study because they only looked at the number of acute cases that needed hospitalization or even intensive care. And there was a clear trend. Countries closer to the equator have a lower incidence of severe cases of COVID-19 due to better vitamin D levels. So all this said, optimizing your vitamin D levels throughout winter and summer has numerous benefits and should become mainstream medicine. The only way to do so is through blood testing, while taking a consistent dose of vitamin D per day for at least 2 weeks to see what blood level you achieve with a certain daily dose of vitamin D. During the winter, we as Canadians practically rely solely on vitamin D by supplementation or dietary sources, while during the summer we have to factor in the level of sun exposure depending on the average amount of time and skin area spent exposed and unprotected to sunlight. With testing, you practically assess your lifestyle to be able to make an informed decision on how much vitamin D to use, to stay within the optimal range in the end. We need to assess our individual winter needs as well as our individual summer needs, and then follow through accordingly. Vitamin D tests are not covered by provincial health plans. We have to pay out of pocket. Labs usually charge between $35 and $45, but I believe in today's pandemic world, this is money well spent. Because it's not covered, it should also not be a problem to ask your doctor or naturopath for a few blood work requisition forms with just the vitamin D test on it. This way, you could test your levels repeatedly, always after being stable on one dose for about 2 weeks, and then adjust your daily intake up or down based on your results. To close out, by optimizing your personal vitamin D levels with the help of blood work, you will catch a few birds with one stone, or as we say in Germany, you'll catch a few flies with one swat. Vitamin D, if dosed properly, will improve low mood during the long Canadian winter, a condition also known as SAD or seasonal affective disorder. And please check our Facebook or website for the upcoming webinar on SAD this coming October 7th. It will also improve your calcium household and help prevent osteoporosis long term. It has received a lot of attention for its role in preventing cardiovascular disease, high blood pressure, and even type 2 diabetes. We have to start paying more attention to our individual vitamin D levels. As always, I hope this is of help to you. Stay strong. See you next time. Thank you.